We will start discussing the front collecting points specifically. So for today, we will talk about lung 1, central residence. Lung 1 is located 6 tun lateral of the anterior midline and approximately 1 tun below lung 2, slightly medial to the lower border of the coracoid process. So how to find lung 1? First, we have to locate lung 2 in the deltopectoral triangle, which is bordered superiorly by the clavicle and laterally by the coracoid process within the deltoid muscle. From there, palpate along the border of the deltoid for 1 tun, and there locate lung 1, slightly medial to the lower border of the deltoid on the thoracic wall, approximately 6 tun lateral to the midline. For orientation, when externally rotating the arm with the elbow flexed at the same time, the coracoid process will remain static, while the minor tuberculum of the humerus will follow the movement. Spleen 20 is also located 6 tun lateral to the midline on the level of the second intercostal space. Located approximately on the same level are REM 20, kidney 26, and stomach 14. Needling of lung 1, 0.5 to 1 tun, obliquely in a cranial approximately 45 degrees and lateral direction towards the coracoid process. Actions or indications. Lung 1 regulates and descends the lung qi, clears heat in the upper burner, transforms phlegm, regulates the water passages. Lung 1 can also move the qi locally and in the sinew channel. Special features. Lung 1 is the front point of the lung, meeting point with the spleen channel because they belong to the same polarity, the entry point. Lung 1 is important point for disorders of the lung. Lung 1 is mostly used in acute excess patterns of the lungs to disperse fullness from the chest, resolve phlegm from the lungs, and clear lung heat. So it would commonly be used in the later stages of invasion of the lungs by an exterior pathogenic factor when this has penetrated into the interior. In particular, lung 1 is very well indicated for cough caused by retention of phlegm in the lungs. According to the book, An Explanation of Acupuncture Points by Jean Schwed-Chair in 1654, lung 1 is a point where the qi of the lungs gathers as the qi of the channel emerges from the interior. This point can be used to disperse accumulation of lung qi in the chest, causing chest fullness and pain. This is not usually used when the pathogenic factor is still on the exterior. So we only use this when the pathogenic factor has interiorized. This explains why lung 1 is not indicated for sore throat from exterior wind heat invasion. However, since lung 1 has a good effect on making the lung qi descend and stopping cough, it can be used in the early stages of invasion from an exterior pathogenic factor if cough is a prominent symptom. So if you have a patient who has cough and has external wind heat invasion, then you use lung 1. So lung 1 would be needled as a secondary point together with points to release the exterior, like lung 7 and LI4. Lung 1 is important and is an important point for the treatment of whooping cough during its second stage, that is, the lung heat stage. Lung 1 is also effective in treating chest pain deriving from heart blood stasis or retention of phlegm in the chest. In chest pain deriving from heart blood stasis, lung 1 moves the lung qi. Therefore, it helps to move blood in the chest, particularly if combined with pericardium 6. Combined with stomach 40, Lung 1 can resolve phlegm retained in the chest by being able to move the chi in the chest. Lung 1 is effective in treating shoulder or upper back pain deriving from a lung channel dysfunction, such as in lung heat, phlegm, or phlegm heat obstructing the lungs. The book, The Simple Questions in chapter 22 says, when the lungs are diseased, chi rebels upwards, causing breathlessness, and there is pain in the shoulders or upper back. Lung 1 can be combined with bladder 13 to tonify the lungs or to eliminate pathogenic factors in both acute and chronic cases. However, the combination of both back and front points is rather powerful. And in most cases, it is not necessary. Generally speaking, the lung 1 would be chosen more for excess and acute conditions, and the back shoe point bladder 13 more for deficiency and chronic conditions. Combined with stomach 36 and spleen 3, lung 1 can be used to tonify the spleen and lungs because they have the same polarity. This combination of points is based on the nature of lung 1 as a meeting point of the lung and spleen channel, as mentioned previously. In 5-element terms, this combination is called filling earth to generate metal. It is useful to compare the functions of the front collecting point of the lungs, lung 1, with those of the back shoe, bladder 13. So lung 1 is mostly for excess patterns, bladder 13 for deficiency patterns. For lung 1, we use this to treat the manifestation mostly, bladder 13 for treating the root. Lung 1 is better for acute cases, bladder 13 for chronic cases. Lung 1 treats pain in the chest, bladder 13 treats pain in the upper back. To summarize, lung 1 is mostly for excess patterns. It disperses chest fullness, resolves phlegm, clears heat, invigorates blood in the chest in combination with pericardium 6, and it is good for upper shoulder and back pain. Thank you very much for your attention.